Hey everybody, thanks for checking out another episode. Today we're going to talk about cholesterol and the top 5 things you can do to lower the bad number and increase the good number and what those numbers mean. Coming up after this, stay tuned. So to begin with, when we're talking about cholesterol, we're talking about 2 numbers. You have your HDLs, which are your high-density lipoproteins, and you have your LDLs, your low-density lipoproteins. Now, exactly what these do, you don't necessarily have to know. But what you should know is that you want to keep your HDLs high and your LDLs low. So your HDL is considered the good cholesterol, and the LDL is considered the bad cholesterol. So now that we know that, on to the top 5 things that you can do to lower the bad number and increase the good number. With number 5, drink only in moderation. So while alcohol itself doesn't have cholesterol, it can affect the blood in both good and bad ways. But first, to understand the link between alcohol and cholesterol, it's helpful that we first understand how alcohol is broken down in your body. The liver does a lot of things, but 2 of those things are it metabolizes alcohol and it produces cholesterol. All cholesterol is not inherently bad. Your body uses cholesterol for lots of things. Consuming alcohol can raise cholesterol levels because alcohol is processed through the same organ that is responsible for making the cholesterol. So excessive drinking may increase that LDL cholesterol. In addition, alcohol is also known to increase your triglyceride levels. And because alcohol is usually consumed with food, your body is more likely to store calories from food as fat in the forms of triglycerides. And then many alcohol drinks also contain added sugars, which further increases the risk of raising triglyceride levels. High triglyceride levels also lead to liver damage. So if you do drink alcohol, drink it in moderation. What does moderation mean? Well, for healthy adults, that means 1 drink a day for women of all ages and 2 drinks a day for men younger than age 65. Sorry, ladies, that men younger than 65 can have 1 more drink a day than you, but statistically they're going to die before you, so then it all kind of equals out, right? Too much alcohol can also lead to serious health problems, including high blood pressure, heart attacks, and strokes. So while it's okay to have a drink, you probably don't want to have your 1 drink look like this guy's. And number 4, try to lose weight. Being overweight also contributes to high cholesterol. Being overweight or obese tends to increase your LDLs, which are the bad ones, and lower your HDLs, which are your good ones. Getting older also causes your LDLs to rise. But it's the small changes that add up. So if you drink sugary drinks, try switching to water. Maybe snack on healthier options, but keep track of the calories. If you crave something sweet, try sherbet or candies with little or no fat, such as jelly beans. And then also talk to your doctor. They can absolutely help recommend ways to help you lose weight. Number 3, quit smoking. Smoking causes chemical changes in your body. Cells in your bloodstream called platelets, they clump together when they react with the substances that are in cigarettes. This makes your blood thicker and stickier. It makes it harder for your heart to push the blood through your vessels. It also throws your cholesterol levels out of whack. Cigarette smoke raises the level of your bad cholesterol and lowers the level of your good cholesterol. And it also increases your triglyceride levels. And all this causes that waxy plaque to build up in your arteries. Also, when you smoke, it causes your blood pressure to increase. And this causes your arteries to get stretched and scarred. And it causes their lining to get scarred. This gives a chance for plaque to stick more easily to the sides of your arteries. And that contributes to the buildup of plaque. And all of this raises your risk for clots, which can block blood flow to your heart or other organs. And this can cause heart attacks or strokes. And quitting smoking actually improves your HDL cholesterol levels, and the benefits occur quickly. Within 20 minutes after your last cigarette, your blood pressure and heart rate return to normal. Within 3 months of quitting, your blood circulation and your lung function will improve. And within 1 year of quitting smoking, your risk of heart disease is half that of a smoker. A tip for smoking is to do it 1 day at a time. Each time you have a craving, be aware of it, and know it'll pass after a little while. Eventually, those cravings become smaller and shorter and less severe. There's also help in the form of medications that can help curb those cravings and make it a little easier to quit. Make sure to talk to your doctor about all the different treatment options that are available to help you quit smoking. There's many, and the doctor can help you figure all that out and recommend one that'll be helpful for you. Number 2, exercise. Exercise on most days of the week and increase your activity level. Just moderate physical activity can help increase your HDL cholesterol levels. At least 30 minutes of exercise 5 times a week, or vigorous aerobic activity for 20 minutes 3 times a week is recommended, but it's recommended to check with your doctor if you have any underlying medical conditions. Adding physical activity, even in short intervals several times a day, can help you begin to lose weight. Some ideas for activity include you can go for a walk during your lunch break, riding your bike to work, playing one of your favorite sports. And if you need to stay motivated, consider finding an exercise buddy. I'm sure there's others just like you that want to get out and get more active and stay healthy. You could also join an exercise group or go to an exercise class like spinning. And the number one way to lower your cholesterol is to eat heart-healthy foods. So first, we want to reduce our saturated fats. Now, saturated fats, which are found mostly in red meat and your full-fat dairy products, they raise your total cholesterol. And decreasing your intake of these saturated fats can reduce your LDLs. We also want to eliminate trans fats. And trans fats are also known as partially hydrogenated vegetable oil. And you can find that on the back of the label on your food product. And these are often used in margarines and then store-bought stuff like cookies, cakes, crackers. Trans fats are going to raise your overall cholesterol levels as well. An interesting fact, the Food and Drug Administration has actually banned the use of partially hydrogenated vegetable oils by January 1st of 2021. Next, we want to eat foods that are rich in omega-3 fatty acids. Omega-3 fatty acids don't directly affect your LDLs, but they have other heart-healthy benefits, including reducing your blood pressure. Foods with good sources of omega-3s include salmon, mackerel, herring, walnuts, and flax seeds. And we want to increase the amount of fiber in our diets. Fiber can actually help reduce the amount of cholesterol that gets into your bloodstream. And soluble fiber is found in things like oatmeal, kidney beans, Brussels sprouts, apples, and pears. And lastly, add whey protein. Whey protein is found in dairy products and may account for many of the health benefits attributed to dairy. And studies have shown that whey protein, given as a supplement, lowers both your LDL cholesterol and your total cholesterol count, but it also helps lower your blood pressure. But in the end, sometimes healthy lifestyle choices aren't enough to lower cholesterol levels. In this case, you'd want to talk to your doctor about medication options. Your doctor can recommend many medications that can help lower your cholesterol levels. And if your doctor does recommend a medication to help lower your cholesterol, just take it as prescribed while continuing your lifestyle changes. And thanks for tuning in to another episode of Nurse Dan. I hope you guys got at least something educational and helpful in this video. If you did, please like, subscribe, and hit that notification bell at the bottom. That'll let you know when I do post new videos. I just want to say thanks for everybody for watching. Stay safe, stay healthy. See you guys next time.